Yes, glad to have you here along with Dr. Syed Hussain from Trinity Health of New England. Good to see you again, sir.
Likewise.
Glad to have you here. Boy, Rachel was just showing in that purple category, the very unhealthy, meaning everybody should limit the amount of time they spend outdoors. We just ticked into that category for the first time as far as I can remember. Just how unhealthy can the air be when we're in a situation
Yeah,
like this?
quite unhealthy, Tim. So especially if you have underlying respiratory conditions such as asthma or a chronic lung disease, if you're elderly, if you're a child, pregnant, those individuals especially need to take extra precautions because you could have symptoms not only related to the lungs but also your throat, eyes, and other parts of the body that may be impacted.
Yeah, and usually the things that I think sometimes people would normally associate with allergies, if you start coughing a little bit more, it might be the smoke these past couple of days. So keep that in mind. It is Men's Health Month. We're going to be talking a lot about a lot of different men's health related problems. One is not necessarily a men's problem. We're talking about the #1 cause of death in men is heart disease. I believe it's the #1 cause of death in women too, but correct me if I'm wrong. I think men tend to be a little more affected by it in terms of proportionality.
It is. It is the leading cause of death in men, and 1 in 4 will die from heart disease, Tim. And what's really concerning is individuals, men who do die of coronary artery disease, half of them will not even have symptoms.
Yeah.
So this is why it's really important for men. And, men tend to put things off and, I'm healthy. I don't need to see a doctor right now. I'm busy. So it's important that health comes first. And, we all know what some of the symptoms related to heart disease are: chest pain, shortness of breath, swelling in your legs. There might be some fluttering in the chest, fatigue, feeling tired more so than usual. But in those individuals who may not have any symptoms, important risk factors to look out for when it comes to heart disease is, have you been checked for high blood pressure? Because high blood pressure doesn't necessarily come with symptoms. Have you been screened for diabetes? These are all questions that that you should ask your healthcare provider, have a discussion with your healthcare provider. Are you engaged in excessive drinking or smoking? Then, it's time to reduce or quit smoking, for instance. And do you lead a healthy lifestyle? Some of the important aspects related to prevention of heart disease.
Is there also any genetic component to heart disease?
There is, but it's all like, for instance, high cholesterol. Right? There's a very small subset who may have a very high degree of cholesterol in their blood, and there are medications for that. But it's important. It goes back to making sure you're seeing a primary care doctor, getting adequate screening, and asking the right questions.
Yeah, I think a lot of what you're saying, especially about men generally lacking to take care of ourselves because of other things in our life, a lot of that can apply to the rise in colon cancer, which we've talked about before. And as far as I'm concerned, we can't talk about it enough because it's showing up earlier on average in people. And that's not just because we're catching it earlier. It appears to be showing up earlier at advanced stages too, right?
Yeah, this is very concerning. We're expecting to see a spike in colorectal cancer, especially in the younger age group. So 2 years ago, the guidelines were revised, Tim, as you may recall, that you need to be 45 or above to get the annual screening. I wouldn't necessarily wait for that annual screening, especially if you have symptoms, such as change in bowel habits. You've noticed blood or abdominal pain recently. Please go see a healthcare provider, or let your healthcare provider know if you know someone, especially a first-degree relative, who has cancer.
Yeah, but I love the idea of screening with colorectal cancer because a lot of times you wouldn't necessarily know that there's symptoms, right?
That's right, absolutely.
Yeah, and it's good that people need to know, and we have to keep hammering home that there's that change. I was just speaking with my mother-in-law last night, who is a retired nurse, so she hasn't been keeping up with the latest medical news, and she still thought the age was 50, so she was wondering, why are you going to schedule a colonoscopy? I'm like, well, sorry, things have changed.
Absolutely, it's the right thing to do.
Absolutely, so thank you so much. It's not necessarily fun, but it's something that has to be done. Doctor, thank you so much for the time. We do appreciate it.
Absolutely.
Dr. Syed Hussain from Trinity Health of New England, always a great fountain of knowledge for us.